Well, self-testing is now part of the COVID response strategy in the United States and the UK. Here in the country, the Food and Drug Administration is awaiting the opinion of the Health Department. Let's find out more about antigen testing from Tomas Navasero of Lab-X. Thank you so much for joining us, Tom. You are promoting antigen self-test kits to do it yourself at home. Why do we need to do this?
Well, Rico, self-testing should have been done much sooner in our country because it can clearly stop the spread and end this pandemic sooner. If we can empower each and every Filipino and every global citizen in the world, we can clearly ensure that we can safeguard mobility so that before we mingle, before we go out, we empower ourselves, we test ourselves so that we do not spread the virus. Remember, it's either asymptomatic or symptomatic, vaccinated or unvaccinated. We are all carriers. So testing is the only way to detect if we are a carrier of the virus.
But how effective, Tom, are these antigen self-test kits versus those done by clinics and hospitals?
They are different. They have to be designed so that they're easy to use, they are safe, and flexible. Of course, it has to be as accurate and as sensitive as those in the clinics, but they must be designed to ensure that the user can easily interpret the results and implement the sampling safely without going up all the way to the sinus cavity. And we definitely don't want to use saliva here. I know it's simple, but that's not good for antigen testing.
But the question is, once they have that kit, right, that self-test kit, how will they be guided accordingly to doing the test correctly and the right way?
Well, we've done two things. We developed an integrated self-test kit here in BGC, which we promote around the world. And we are now serving the travelers in the UK. So what we've done here is we've included a AI-based symptom analysis for COVID, so that there's a pre-assessment to see if the patient is high risk or low risk. So if the patient is low risk on the AI system, then there's no need to do a test. But if it's medium to high risk, then they must proceed and do the test. Second, for those who really don't know how to do it, which is really simple, we provided a Zoom system so that they can talk to a nurse who can guide each and every step and interpret the results, and at the same time provide a certificate of negative or positive results for that patient anywhere in the world. This is the first ubiquitous self-test kit that we promoted outside of the Philippines, and it's really helping travelers and people going back to work. And hopefully we can bring this to the Philippines and help our students go back to school, our workers stay at work, and our families stay safe at home.
Okay, how often should one test themselves? Because, of course, when you say antigen testing, it could cost about 1,000 to 1,500 pesos. RT-PCR ranges from like 2 to 4,000 pesos. I mean, there's a price tag. And
yes,
how reasonably priced are these self-testing kits?
Well, we need to price them affordable. So this is a testing, not a test kit. So by removing the cost of the nurse going to your house or going to your office to test, we've reduced the cost, right? We've reduced the cost of the laboratory. So now my understanding here is that we hope to have these in these pharmacies and retail shops at $3.99. This is the platform, not for a test kit, but for a testing. So this is the lowest price that we can provide to our Filipinos so that they get a certificate of results at $3.99. And we hope this is affordable. I hope the government can buy in a larger volume so that we can get the price down much lower based on the economies of scale.
When do you think will this be available to all our kababayans? When will it be available in drug stores and pharmacies?
Well, it is available. We've sold it to the world. It's available in the Philippines. You can use GrabMart. If you're really praning and you need to test right away, you can get it as fast here in NCR, as fast as you get your Big Mac on GrabMart. Second, we hope to have it in stock in many of the leading chains of drugstores in the country, and hopefully the leading convenience stores, so that it is truly accessible, so that we can test anytime, anywhere. We either have a symptom or we just want to make sure that every week, every Monday before I go to work, we test ourselves. And that's how we ensure stopping the spread and ending this pandemic.
Tomas Navasero, the CEO of Lab-X on antigen self-testing. Thank you so much for joining us on The Final Word.